Rather than go through the sort of the potted history of HPV, I think we've assumed that most people in the room are providing to the Victorian healthcare market, and so probably know a little bit about HPV. And really, this is about Recallnet. And before I get into us, just listening to these presentations and reflecting, the community, and we are part of the community, would just assume that this is happening. We buy something online. I was just sort of talking, I think, to Ken before we started. We can track that parcel, within a few kilometres until it arrives at our house. Even online shopping now, Woolworths and Coles, you can now track your delivery instead of that sort of 3-hour window. It's down to half an hour. I think we as members of the community just assume that there is traceability, and there's a lovely photo out in the reception of a little kid being treated by a doctor. That family assumes that there's some sort of control over what's being used on that child and the fact that it's fit for purpose, and if something goes wrong, that we can actually fix it. And so in the grocery sector, yes, it's vital that products are fit to eat. My background's in the food industry, making chocolate bars, and I can assure you that our quality standards were very high around producing something that's being eaten. But when we're talking about medical products, we seem to be struggling, and the complexity around this is enormous. You as suppliers must be sitting there going, well, this sounds great, but I've got all the state health departments, I've got the TGA. When Martin from HPV first told me about Recallnet, I was suspicious. I said, what's the catch, Martin? This is too good to be true. It can't be that easy to get all these suppliers lined up, and it is complex. And both Michael and Ken put up the TGA statement because that was confusing, because we have this regulator. This is just a sensible, very worthwhile initiative, but we can't actually sort of nationally at a bureaucratic level necessarily mandate it. So it becomes confusing for you. So I applaud you for being here to try and understand it a bit more. And I think what has been talked about so far is an attempt to try and explain it a bit more. Then you bung someone like HPV into the mix. We're not a hospital, we're not the government, we're not a regulator, but we're actually embroiled in this as well for all the right reasons. But I can completely understand that it might be a little confusing, and I think we all agree though that it is really the right thing to be doing. So being the right thing to do doesn't always make it easy, as they say. So I just wanted to start with that because we're really here to I guess, put our weight behind the value of Recallnet. So HPV has been around for about 13 years. We're a little different to the other state purchasing groups in that we're a statutory authority. We're not embedded within the Department of Health, but we're funded by them, and we report to our Minister for Health. And our purpose is to achieve best value supply chain outcomes for the health sector in Victoria. So product recalls fit smack bang into good supply chain outcomes from our point of view. So we're quite committed to this. Our legislative, we're best known for running statewide tenders, which I'm sure you love, but we've got quite broad legislative functions around policies. So one of our streams of work at the moment is implementing a new strategic policy framework across health in Victoria. We've got requirements around supporting the uptake of e-commerce, around providing useful data that hospitals can access and other healthcare providers. We've got a requirement to support probity. So our legislative functions are much broader than sort of just tenders, and over time we're sort of expanding to fit our legislative mandate. So why in particular are we supporting Recallnet? For all the reasons I just outlined, and for all the reasons you've heard this morning, but also because of where we sit in the Victorian health supply chain and our role as the body that puts in place common use contracts that are mandatory for all of the hospitals in the state. And so we're in the fortunate position to be able to help make this happen. So our Minister for Health has tasked us with getting beyond just putting contracts in place and looking at end-to-end efficiencies in the Victorian supply chain. And if you work with the Victorian health supply chain, you'll know that there's opportunities for health services to be more efficient in how we work with suppliers. And so the numbers around 600 or 700 recalls a year mean that there's a large impact on productivity and efficiency, which we've heard about. So we're all for streamlining processes. This is a national process, so it's one of those rare events where you can do it once nationally and you don't have to then deal with all the slight variations that each state does. Believe it or not, we don't do it to annoy you, it's just the way it tends to happen. And having standardised formats as well. So that's a real bonus that we get through the GS1 involvement. The 4 to 6 weeks for the information to end up with the right person in the supply chain who can actually do something about the Recallnet is just staggering. A lot of that product could be used in that 4 to 6 weeks. My background after chocolate, included a stint in a hospital, and we used to dread when those faxes came through because then we'd be bombarded. So the CEO would forward it on and the CFO would forward it on and various people would forward it on and it would all end up with us in supply. And then we'd sort of start the scattergun approach. So it was a very, very manual process, and I don't think anything much has changed in the last 6 or so years. And so really getting that timely information is really valuable, as you know. You've heard about the ability to track responses and follow up if there's a health service you haven't heard from. So all really powerful stuff. And look, you've also heard, so it's nice to be last because you can think of this as a recap, the benefits around patient safety, which is what this is all about. And we heard the little case study from Ken of the person who comes in for surgery. But so many benefits for patient care. And one of the things that Sandra and I were talking about earlier this morning was when we get a real recall, touch wood it's not any of yours, we want to build up a case study of what it meant for hospitals to be able to use Recallnet as a way of promoting the benefits to patient care through having this more efficient process, rather than have us sort of write to CEOs of hospitals and say this is important. We want to actually show the benefits that have been achieved in improving that patient care. And I think that's another thing that HPV can do to help promote this. Our role in Recallnet, as I mentioned, in Victoria we are sort of within the supply chain often between suppliers and hospitals for the 600 million or so in hospital spend that's under HPV contract. And because of our devolved nature, we don't have one Department of Health in Victoria that can necessarily mandate things to all 86 independent health services in Victoria. So part of our role is to do that implementation with health services. So HPV took on the task of coordinating the registration process, the education process for our health services, whilst also helping with getting the message out to suppliers. And doing sort of things like assisting with the training and the mock recalls. So our role's been quite active, I think, to date, and I think that will stay the case to try and get the two ends up to speed, the supplier critical mass and the health service critical mass. Importantly and underlined, that HPV never has had and won't have a role in actually actioning recall notifications. We put the contracts in place, we don't actually do the transactional stuff. It's the hospitals that do that, and it's the hospitals that have responsibility for actioning recalls from that end. And once a hospital is live on Recallnet, they'll manage their own ongoing administration. So if personnel change, it's the hospital that will do those updates. So we're really, I think, an enabler of getting recall up and going in Victoria. We will have an ongoing administrative role, gathering information on the notifications and just overseeing general sort of account information and making sure that the value is being achieved. In terms of where we're at the moment, and again the data's out of date, things are changing quickly, we almost need a sort of a temperature gauge of how many suppliers and health services are on recall. It could be 52 by now, we never know. But recently, we had 37 of those 86 Victorian hospitals and health services registered, which is a great achievement because we've only sort of been promoting this for a few months now, since January, something like that.
November, I think, first.
And there's some big health services in that list. So in terms of coverage of the products that are being used, that's significant. We have 8 that are actually live, that have gone through the full internal process of updating their own policies and procedures and are actually live to use Recallnet, which is a great achievement. And I'm not even going to, some suppliers, maybe 10, maybe 50, are actually registered as well. So we need more. That's the message. And HPV's done some work reviewing our requirements for doing business with HPV around our invitations to Supplier, our tenders, and it will be a requirement of tendering that you commit to taking up Recallnet within, I think, 3 months of being awarded on any of our new contracts as our tendering program rolls on. And obviously we are discussing Recallnet with suppliers, as evidence here. We know that there's a lot of work to do. There's certainly a lot of work for our health services to do, just like suppliers, because they already have internal recall policies and procedures. And so there is that effort, and that's why we have 8 live at this stage, possibly 9 by now. But we're committed to working with those health services so that when you are set up and ready to go, you have the recipients ready to go as well. Otherwise, we can't get the full benefits of it. And you know, I always love to hear about world firsts in healthcare happening in Australia, and I think it's a great achievement that we have a very sophisticated grocery model, and that's being picked up by health. There are lots of things we can do in the supply chain. Victorian Health Services aren't leading the way in uptake of e-procurement, it's fair to say, on a sort of mass basis, but this is a great way to get some benefits in the supply chain. And in case you missed it earlier, there's the process. So I don't think we need to say any more about that. Thanks, Michael. I was a bit worried about having to explain all that. But it's complex. No one, we can't get away from the fact this is complex. And, I think Ken's slide earlier of the life cycle of the product, and every bit of it is involved in a recall, sort of sums it up. So any system that helps with that is